How many of you are familiar with this ladder? WHO 3-step analgesic ladder. So I see few hands going up. Yeah, this is a ladder which we follow in adult chronic pain. We follow this ladder. We say 3-step analgesic ladder. Step 1 consisting of non-opioids. Step 2 consisting of weak opioids. And step 3 strong opioids. So if you have mild pain, start with step 1. If you have moderate pain, start with step 2. If you have severe pain, step 3. It's a very sliding ladder. You can go up and down depending upon the severity of pain. Mind you, it's not about the stage of the disease. It's how severe the pain is. That's what decides which step you have to choose. Now, the recent consensus is that we use the same ladder, but the World Health Organization has recently introduced this concept. They say, do away with the step 3 ladder. It's a 2-step ladder. They made it more simple, and there are reasons that why made it 2-step ladder. They say, start with step 1 for mild pain. If not better, straight away go to step 3. They have done away with step 2. I'll tell you the reason. But this is the basic approach we follow for any chronic pain management. We are going to have a workshop after that. We'll follow these things to make a point. So, when I say non-opioids, we usually mean non-steroidal anti-inflammatory medications and paracetamol. You don't have to look at this dosage right now. You can always refer to this later on. You can always have it on your apps. You don't have to do it by heart. But just to let you know that these are the commonly recommended medications by the World Health Organizations for chronic pain in children for mild pain. So that our boy, Pradeep, he has scored 8 out of 10. So do you think this will be enough for him? No. Obviously, we need to step up. And our next approach would be step 2, and which is strong opioids. Now, why I said we don't use step 2, that means weak opioids in children. There are several medications, but what they have found is the recent evidence. I know that many of us, we like to use codeine in children. Yeah? How many of you use codeine in children? I see many hands going up. All of us, we have used some point of time codeine in children. We think codeine is safer in children. But now more and more studies says that because of each individual, codeine is a prodrug of morphine. When you take codeine, in the body, it is converted to morphine and then it produces its action. But in the body, how it's going to behave, it varies from individual to individual. So the thing, when it is converted to morphine, why do you want to take codeine and see how it's going to work in that person? Why to take that risk? So they're saying it's not, even for tramadol, they say we don't know how it behaves in the body. So because of this unreliable plasma concentration which we may achieve, they say do away with step 2. Don't use step 2. Straight away go to step 3. Step 3 means strong opioids. The common strong opioids which we have in India are morphine, fentanyl, methadone. These are the 3 strong opioids which we use in India. So if Pradeep, we have to use step 3 means we have to use either one of these opioids. I want to spend a little 2 minutes on morphine. Morphine is the drug of choice for severe pain in children, world over. There's no dispute about it. There's no confusion, there's no dispute about it. Morphine is the drug of choice. How many of you seen morphine? How many of you seen morphine tablets? I'm amazed, at least you're seen. But I also see some hands not going up. And I'm not surprised, yes. I'm not surprised. If I speak to a doctor's forum, suppose I have 100 doctors sitting here, I don't see many hands going up. Because it's not one drug which is very freely available. But the point is that Dr. Hariprasad spoke about so much of need for even a non-cancer. And our previous speaker spoke about even non-cancer and pain. Pain is there in every chronic persistent situations. And morphine is the drug of choice. And the World Health Organization, they have essential drug list, and they have all these formulations very well defined in their essential drug for children. And they have all these formulations, they say it is essential. Every country has an essential drug list, and they say it should be there in the essential drug list. India has essential drug list, and we have oral morphine. We don't have a separate essential drug list for children. I'm not very sure. Do we have essential drug list for children? But do they have morphine in that? Very good. So it's a good news. We have it. Then it should be there in all the hospitals. So when you use morphine, we'll have more exercise in the afternoon. Remember that morphine has the oral morphine. I'm talking about tablet morphine, not injection morphine. Morphine works for only 4 hours. So when you're using morphine, use morphine 4 hourly and double the dose at bedtime. Suppose you're using morphine 4 hourly, 6 o'clock, 10 o'clock, 2 o'clock, 6 o'clock, 10 o'clock. So this is how it works, 4 hourly, right? They say give the double the dose at bedtime because next dose is at 2 a.m. So why do you want to wake up a child at 2 a.m. and then give him that dose? So they say rather give double the dose, and their studies have found that it is good enough to cover the whole night. So that is the approach we take. Whatever with the dose of morphine, give double the dose at bedtime. And when you start morphine, start one dose, let's say 5 milligram 4 hourly, 10 milligram bedtime. If the pain is not relieved, next after they say wait for at least 48 hours, increase the dose to at least 25 to 50%. So suppose a patient is on 10 milligram 4 hourly, 20 milligram bedtime. Pain is not better. What will be my next dose? If you increase 50%, 15 milligrams. So 15 milligram 4 hourly, how much will be the bedtime dose? 30 mg. So that will be our dose restriction used for morphine. But always they say, please always have a PRN dosage as a backup, because many times there will be some in-between pain, and they should have something to take care of when some in-between pain is coming. And we say that pain we call it as breakthrough pain. And they say always have a backup of extra dose of same dose which you are taking 4 hourly, just to keep it simple. Suppose 10 milligram 4 hourly, 20 milligram bedtime, 10 milligram as PRN dosage. There is beauty of a drug like morphine is there is no upper limit. You cannot say, my God, 20 milligram, already he is on 10, what next? And clear instructions to the parents about the rescue dose. Rescue dose is same like PRN dosage. So please understand, always explain to the family, even if in between more pain, take this extra dose. That instruction should be very clear. There's a dosage regime which I mentioned for smaller children. I'm not going to detail. So that was about morphine. The other drug which we use is fentanyl. How many of you used fentanyl or seen fentanyl? I see more happy hands going up now, fentanyl. Obviously, fentanyl is one drug which is sold by pharmaceutical, driven by pharmaceutical, because it's expensive drug. If you write a lot of fentanyl, you will get a lot of benefits. So it's very commonly used in India across all the specialties. But remember, you can use fentanyl in children, but there are some disadvantages. It is not recommended for unstable pain. When you're not very sure how much opioid you need for a child, avoid fentanyl, rather titrate on morphine. It is never a first line. Fentanyl is never a first line. And suppose, remember I spoke to you about PRN dosage. Suppose in between pain you have. Fentanyl is a patch. You apply a patch. So you cannot have anything to deliver more drug through the patch. So you have to take oral morphine again. So you have to have fentanyl and oral morphine together. Suppose you're prescribing fentanyl. In hot summer, remember patch. Nurses face this problem often. You say apply the patch. And often the patch doesn't stick properly in summer, and the absorption becomes very erratic. And the most important thing in fentanyl is that it's very expensive. It's almost 30 times more expensive than I think oral morphine. So most of our patients, they can't afford when you talk about long term. Another new drug which has recently been introduced, just to give an overview, I'm not going to detail because this needs a lot of specialized training when you're using methadone. How many of you heard methadone? In what situation have you heard of methadone? Pain management. Have you heard of methadone in any other usage? Exactly. In India, it's been there for replacement therapy, for drug addiction treatment. It's been there. Now, recently, a couple of years back, we got methadone for pain management. It's available as syrups and tablets. We don't have morphine as such in syrups, but methadone we have in syrups. That's a beauty. And it's never a first line. It's usually used as a second line, and usually used for complex neuropathic pain syndrome and for opioid rotation. When we use one opioid, it doesn't work. Suppose it develops toxicity, we rotate to another opioid. That is known as opioid rotation. We use methadone in that special situation we use, because other than its opioid action, it also has additional action like NMD receptor antagonist action. So methadone is a very special drug. It's a nice drug when you know how to use it. But you have to be very careful. It has its own problems. It has a prolonged half-life. Suppose you start methadone, sometimes after 5 days you know patient is drowsy. So you cannot send away a patient to start methadone and go home. Like sometimes it's because of prolonged half-life, it may have its problems. QT prolongation, they say sudden deaths are reported, and there are a lot of drug interaction of methadone, so we should be very cautious. So the frequent assessment is the recommendation. The most important is that it should not be used by anybody just like that. You need to have special training. So the strong recommendation would be, first get used to oral morphine. Once you know, understand the dynamics, how opioids work in the body, then only we should think about methadone. Same boy, he was on morphine. 72 hours later, he was quite comfortable. But then we heard that this boy was very irritable, irrelevant talk, and drowsy. A child with relapsed leukemia, in pain, we put him on morphine, but he became drowsy, irritable, and talking irrelevantly. What is happening? Sorry? Liver function test. Anything else? Kidney function test, very important. Renal failure setting in. Again, bleed. Yeah, cerebral bleed. And your morphine, possibly. Suppose we are using morphine to a level which is more than required. He may be having some kind of morphine, we say overdose or toxicity. So I'll just briefly tell you about when you use opioids, we have to bear in mind that all opioids, whether using tramadol, morphine, fentanyl or methadone, they all produce constipation. All patients who are on opioids, you should remember to write laxatives. It's criminal if you don't write laxatives with opioids. Please, whenever the hand which writes opioids should write laxatives. Other common side effects of opioids are nausea and vomiting, some initial drowsiness, itching, and urinary retention. These are some common side effects. You may see some toxic effects when it exceeds what is required for its pain relief or therapeutic effect. When you know when the patient is developing toxicity is when the patient is very drowsy, patient is eating and sleeping. Myoclonus, abnormal, they say, pata nahi kyun sote sote haath aise jhatak raha hai. Myoclonus, abnormal movement. Delirium, confusion, or respiratory depression. So these are the toxic effects of opioids. Quickly, some of the myths. Withhold morphine for the last few days. Morphine hastens death. Morphine causes addiction. These are the common myths which often comes with morphine. We know that which is all not true. And there are several studies to say that addiction, this is a very Indian study which talks about addiction, and they found it's not addictive. And another study which talks about in children, they say that this is a WHO recommendation, they say it is not addictive. All pain cannot be treated with morphine. You remember you said about neuropathic pain and bone pain. Then you need special medications. Some other group of, we call it as adjuvant medications. So not just morphine, it's not always morphine. You may have to combine morphine with some other medications. Suppose patient has inflammation, you have to have anti-inflammatory medication. Spasm and muscle relaxant. So you have to have muscle relaxants. So finally, I just want to talk about the final slide. Jean mentioned about pain. It's not just about scoring pain and that's a good assessment. It's a narrative, and there's a lot of other angle to pain. So when you talk about pain management in children, it's not just about giving medications. It also involves a lot of integrative approach, giving a sense of control, accurate information, physical therapies, touch, massage, warmth, cold. I think you're going to hear more of these things when as we discuss further, and bringing them to normal life as much as possible, and sleep routine. I'm going to conclude this with a small video, just 2 minutes video, and we'll conclude this session.
Hi, how is everyone today? You're gonna get some needles today, young lady.
Yeah, we are. Thanks.
Stop! You know, Mom, it doesn't really have to be this way. I know you're afraid of needles, but I don't have to be. You can distract me with some fun games and get me to take a few deep breaths and play behind the You can even put a special cream on my arm so the needle won't hurt so much. could all be a lot easier. Still use topical headaches to help. Do the smoke me skin or to sing a song. Do the chord me to take some deep breaths and play with my lullaby. Don't tell me it's gonna be okay. Don't tell me it'll be all the same. That can make me feel worse. It's better to take my mind off. Morning, good day, tell me. Come here, Bubba, please.
This has been really helpful for me. Please share this with your friends.
Remember, distract, take deep breaths, use topical anesthetics, and don't say, "It'll be okay," or "It'll be over soon." To learn more, visit our website.
So that's in a nutshell just to say about how pain should be combined with integrative approach, combining pharmacological and non-pharmacological means to help the children. Thank you.